I'm really happy that we've got Dee Hardy presenting today. So Dee is a Family Dispute Resolution Practitioner. But what I've asked her to talk about today is the family reunit work that she's been doing and having some really interesting success with. So I'm very excited to hear. Before we go any further, though, I would like to acknowledge Aboriginal and Torres Strait Islander people as the traditional owners of Australia and pay my respects to elders past and present. I'm coming to you from the lands of the Gunai Kurnai people in Victoria.
Thank you so much, Joanne, and also the Mediation Institute for giving me this platform to share what I hope is going to be an interesting subject matter, and perhaps some of you have heard about reunification therapy. It's something that I've noticed in the last sort of 6 to 8 months becoming a little bit more mainstream. I was introduced to it earlier on in the year, last year, when a mediator actually forwarded some clients to my therapeutic practice, and they wanted to help assist in that sort of high profile, high conflict, I suppose is the best word for it, situation where there was parental alienation, he said, she said, and all the rest of it. So I looked into it a little bit further and have realised that it's something I feel that's probably an area that's going to grow quite substantially, reunification. We know about court report writers, we know about child impact reports, but reunification therapy is a dynamic space that almost takes those court reports and those child impact reports and puts them into practice, where you actually sit with the clients and you work through how can you actually ensure that things are actually going to be moving well. I'll go into the first couple of slides. So the introduction to reunification therapy, I feel it's been around for a long time, but I think there's a little bit of formality that's coming into it just in recent time. It's designed to repair fractured relationships, as the word does imply, between parents and children post-separation and divorce. As we understand, when children go through separation, depending on where they're at in their life stage, whether they're between 0 and 5, from 5 till 10, 10 till 15, even when they're young adults, the dynamics of the parental relationship with the children becomes quite heightened. I know myself, when my parents went through a separation, I had this enormous compassion for my father for no other reason than I just had that connection with him, and anything my mother shared with me, I was immediately against it because I felt that my father was the person that was hard done by. So you can see that children can easily defer to a parent. And when we talk about alienation, which we'll talk about a little bit later on as well, that can come from a number of different areas. So alienation could be something, as we've heard before, that can be created through the parent themselves trying to alienate their child from the other parent. But the more work they do in trying to create that alienation can actually then alienate themselves from that child. And I'm sure that some of you have come across that before. And the purpose is to build emotional connections and create a stable environment for children, which is the work that we're trying to do by keeping families out of the courts and working through the ability for them to make decisions independently, to self-determine as to what's in the best interest of their family unit. But we need to bring parents out of that high conflict into thinking about the children, not about their conflict. And that is something that we're seeing time and time again. So establishing rules for respectful conversation during therapy sessions is part of what we do in reunification. And there's a lot of work that happens with the family member, the parent themselves, as opposed to focusing on therapy in children. And this I've discovered anecdotally over the last couple of years that there seems to be an onus on, okay, why don't we do work with the children? Why don't we provide them with therapy? Because they're the ones that are going through the trauma, subject to alienation, psychological trauma. At the end of the day, it's the parents that should be taking ownership and equity on their behaviours or lack of behaviours that's impacting the children. And that's where reunification therapy is trying really hard to make an impact. And this is a great slide that says just because some people are fueled by drama doesn't mean you have to attend the performance. And part of the work that I've been doing in reunification therapy, where the parents are in high conflict, is to empower the children to become observers of their parents as opposed to participants in their narrative because of the drama that they're deciding to be part of. It's we accept and acknowledge that the space that we all work in is high conflict and there is high drama, but we can try very hard to help separate that from the children and from the adults. So when we move forward into where things look from the principal side of reunification therapy, it's about relational patterns and issues. For example, a teenager's hostility towards their father, the feelings of abandonment might come through that. And again, in the reunification space, we're using those therapeutic tools of Maslow's hierarchy of needs, the attachment theories. A lot of the time we can misdiagnose badly behaved teenagers because they're going through the separation and divorce of the family members. But maybe sometimes there's something deeper going on there. Just because a child is deciding they don't want to be with their father, it might mean that they've had some issues with the father not being present and being absent, or it might be because they're protecting their mother. And that's another area that we have to be very aware of. And another intervention strategy is guided discussions to build understanding, the psychotherapy around what happens in the family environment, to explore shared values and connections. What does it mean to be part of a family unit? A lot of the time I've come across people that have been adopted, for example, and even though they've had happy family environments, later on in life, the curiosity of finding out who their blood parents are, even though they've never known them, is a strong bond and a strong connection for human beings. And it's the same when we're exploring shared values and connections, even though mum and dad might not get on, and children may actually say, oh, hang on a minute, I know mum and dad don't get on, but deep inside on a primal level, everybody wants their parents to stay together because that's normal. It doesn't matter whether it's good, bad, or indifferent. But to understand that as a core principle in children, to help them through the process so they don't get angry at one parent for leaving or get angry at the other parent for staying, because that's also sometimes that comes out of the space of separation. Integrating input from therapists, mediators, and educators. And this is where I'm really quite passionate, coming from the space of not only being a therapist, but also a mediator. I've found it's really important that there is a strong collaboration in the different skills that are working. When we talk about reunification, when it comes to mediators, and I'm not sure, and I'd love to get some feedback from some of you, it is incumbent upon us as mediators to identify if there's a gap in support for the family unit. We can make some suggestions if we identify that there needs to be support. And therapeutic support is one area that obviously stands out most of the time. The reason why they're in mediation is because they can't communicate, because there is high conflict, and we're trying to support them in not having to go through that whole legal system. So being able to sit down with the families and mediators and maybe even educators in that space, and that's even the schools, to help support the children to understand that it's okay to start working together. It's okay to start communicating, to understand what is going on. Like a school counsellor can give you some insights about how the children's behaving. I had a case last year, a 14-year-old boy who was residing with his mother down in Sydney, and his father was up here, and he had regular school trips up to Queensland to spend time with his father. And it wasn't until the school counsellor rang the father and said that the boy is struggling at the moment, and he's sharing in therapy that he wants to spend more time with you, the father, and move away from the mother. So they had to spend a bit of time through the therapeutic process to understand what was happening. And the child was not able to articulate himself to his father that he wanted to spend time with his father, because the mother would then pay out on him, would actually create the conflict again by saying, you favour your father, you don't favour me. But at 14 years of age, his needs have been shifting and changing through his lifestyle and time of life, and wanting to spend more time with his father. So sometimes school counsellors are really important to tap into. When we think about the child inclusive mediation space, it's important that we do get the voice of the child involved in the process, but done in a way that's not an environment where they can side with one parent or another, but to find out whether or not there are some issues behind the scenes that can be addressed so that we can make an informed decision. When we look at the reunification therapy in family law, so at the moment, the courts are actually starting to implement some reunification therapy in co-parenting spaces. And I'm sure some of you have actually seen that, where the judge orders the reunification therapy for families, where there's suggestions of alienation that have been made. And again, I'm really pleased that the courts are starting to identify that it's more than just making a co-parenting plan. It's ensuring that the children's voices are being heard and how they're experiencing what's happening within the family unit is being identified so that it is not exasperated, that some of the trauma that they're feeling, the alienation that they might be subjected to continues. I'm dealing with a family at the moment where the father is a Muslim and the mother is Australian, and they have 2 children. And they're currently being mandated to go to Reunification, which I'm supporting them with. They have 2 children, a boy that's 14 and a girl that's 16. And the 14-year-old boy had been bullied for many years because he's quite dark-skinned and he's out in the rural areas, and he was bullied a lot at school because he's of Muslim faith, whereas the girl, she had a lot of Australian friends. Now, the boy is now, mum and dad are now separated, and it's high conflict, as you would imagine. The boy is now very much wanting his sister to cover up, to only be around Muslim people and not Australian people, and he's completely alienated his Australian mother. And the courts have actually said that the parents have to come together, as we understand. And it's a very difficult cultural space to be in, understanding the differences between the 2 parties. And as I shared with the mother, for many years, she had been very much subdued in the relationship where the father was very much the authoritarian in that dynamic. And the 2 children have been brought up in that space, and the boy in particular, seeing that dad had the voice and the last say, and mum was always sitting back and saying yes. And eventually she's decided that's no longer healthy for her, that's no longer good for her. So those dynamics are also really important to take into consideration, those cultural nuances and the years of learned behaviour that they've been exposed to, in order to, again, assist them. In this reunification process, they had to go to a contact centre, and the 14-year-old boy is absolutely refusing to go to a contact centre and is completely offended by being in a space like that, and is really pushing to have one-on-one with his sister. And of course, we're working through that. But again, the courts have said you must go to a contact centre. So where does the line draw? What do we do? Do we listen to the courts, or do we find another way that we can actually hear the family and see what's important for them? So it's a really interesting balance at the moment. And it's balancing confidentiality with court reporting obligations. Do we find a way to bring the 2 together where it is forced to go and see the family together, or do we manage something that's in a far looser way? So summary reports, while safeguarding the child's safety obviously is number 1 that we've all heard of, but I think there needs to be an enormous work on listening to children in the background, and that's very much something that's coming out of some of the situations that I have found myself in. Good days give you happiness. I just thought I'd break some of the serious stuff up. Bad days give you experiences, worst days give you lessons, and best days give you memories. And even though when we deal with people in the space that we're in, and it might be at the worst stage in life, this too does change. And I think it's really important to actually shine some hope in the eyes of the experiences that these families are going through. So the observations of the family law system, I'm finding this myself, and certainly through families as well. I was dealing with a family of 3 children and a husband and wife who've separated, very adversarial. And they've had court reports, child inclusive mediation, reunification therapy. There's overload with multiple supports. And I think we've got to be very careful that we don't overdo it either. Families often experience therapy overload, and so do children. They have to recite the same story over and over again. And I don't know whether that's actually the right thing to do. For example, if a child's involved in a psychiatric evaluation or family reports or reunification, he feels or they feel emotionally drained. These 3 children of this other couple that we're dealing with at the moment, one of them's got epilepsy. He's 11 years of age, and every time he is forced to have to consider the reunification with his father, he actually starts losing his breath and goes into an epileptic fit. And then you have to consider, okay, is there parental alienation happening? What's in the best interest of the child? They're entitled to a relationship with their father. So very difficult grey lines to be able to navigate. Parents in high conflict case struggle with conflicting recommendations from professionals. As neutral as we all are, they can have a viewpoint, a high conflict parent, And if it's not aligned, your recommendations or your suggestions are not aligned with their thought process, they're not going to play game. They're not going to actually fall into it. Another one of these clients is one of the most well-respected court report writers who's been in the game for over 20 years. The client didn't like what was in the report, so he's going to take that to court and get it reevaluated. So again, the system has these options and avenues, but is that really taking care of the children? Just going through my slides. So no unified process to guide families through these interventions. And this is a really interesting subject, and I touched on it with Joanne earlier. A child's voice gets lost when professionals don't coordinate effectively. What I have experienced recently is that there are a lot of silos out there. So it will be the court report writer or the child inclusive mediation or the therapist of your reunification therapy, but there's no case management happening. There's no one person that's bringing it all together, because there are double ups. When I was working with this one family last year with a court report writer, I took it upon myself to call to say, I want to make sure that we can collaborate together with a unified voice, as opposed to doubling up on what we're both supposed to be doing, because there are crossovers everywhere. But who's incumbent to do that? Is that perhaps the mediator's role to case manage? I don't know. Is that something we can maybe think about, maybe talk about? And Joanne might have some ideas about that. Because from time to time, and I'm sure everybody else experiences this too, we do get regular phone calls, and I certainly have had, when they're asking for suggestions and guidance to move forward. But of course, our roles as mediators is very much just in that space. And as soon as our job is done, we let them go. I think a lot of families are struggling to know, who do I go to? Who is probably the best person to talk to in the first instance when I do go through separation and divorce? Is it the lawyer that by nature is the win-lose? Is it the mediator that can sit down and support the self-determination of the family members? Is it therapy to help de-escalate that heightened conflict space that the parents are in? Because when you're in that high conflict space, it's all near impossible for them to make any sound decisions because they're still so very heightened. Where do we actually collaborate? And I'd welcome some feedback from you either now or later on as to, is there a better way? Is there a better way to manage children, and how to ensure their voices are going to be heard? When we work with psychiatrists, psychologists and mediators to streamline support, that's great. If the report writer ensures that therapy goals align, but again, who is the coordinator of all of that? And how do we maybe have early intervention programs in relation to supporting children? Does that come from the mediator or the child-centric approach? Therapy focuses on parental psychoeducation and cause and effect reducing pressure on children. That's really important, to educate the parents on what they're doing and what they're not doing and the impact it has on them. It's a very rich space of opportunity, I feel, to assist and support children and families. And is the mediator the person that is the best role to affect a case management coordination for all of these things? Because that's the space that we come from as mediators. We come from that child-focused space and that non-adversarial space. This is something we all basically understand and know, that mediators learn to manage emotional discussions effectively. That is our skill set. And to validate the parents' fears while steering the conversation towards solutions. That is what we do all day, every day. But inside of all of that space, when there is that heightened sense of conflict, we're not counsellors, we're not therapists as mediators. We're there to provide a solution. Using tools like these, and I have to mention this, Joanne, I'm such a big fan. As Joanne knows, I've utilised the Bill Eddy conflict resolution model quite a lot, and it's actually been very successful, Joanne. I have to say I'm really happy with it. And it helps not only for us as mediators, but hopefully families to understand the impact of what they're doing to children. And this is a tool that we've all got available to us. And I'm not sure whether any of the other mediators have actually embraced that, but teaching parents how to write respectfully, using I statements when they start communicating as opposed to pointing the finger and dictating to somebody what's happening, keeping emails to the basic facts. as opposed to putting emotive suggestions in there. All of those things help reduce conflict, which at the end of the day is important for the children because they're the ones that get caught up in it. And I've used the words a few times. It's not only the parents' actions, but it's their inactions. And we all understand the concept behind energy. Even if mum and dad are not saying anything about the other parent, but they have a lot of fury and anger towards them, the child picks up on that. It's those things that we need to be very conscious of. I'm a big fan of Bill Eddy, so we'll plug that a little bit here today, Joanne. Hope you don't mind. And for us to be empathetic, which is very much a part of the mediator's role, is to understand that emotional triggers and high conflict will be there. And at the end of the day, it's not for us to support them in those emotional triggers, but maybe is to give them some guidance and recognize that the anger might be from a loss perspective, for example. It might not necessarily be because they're not getting what they want from the other parent, but maybe it's the fear of losing the child. So this particular Australian mother with her children and the father being Muslim, her fear is that she will lose her children. And when we talked about that in depth, she will never lose her child. She will have to accept that perhaps they will decide on a different sort of cultural direction in their life, but that doesn't mean she's losing them because they're not hers to own. And sometimes that language is really important for parents to understand that you don't own your child. A parent's role is to prepare their children for adulthood. And quite frankly, that as a parent, by the time the children become teenagers, their role as parents are becoming redundant. They're almost semi-retiring from a parent. They're still a mother and a father. But the role of a parent, which is to guide and support and to teach, that steps back when you then allow your child to show you the skills that they've learnt from their upbringing to become young adults. And sometimes that's a really important guide to share with family members, and especially mothers when they go through that phase where children are going through that empty nest sort of phase. They do feel that. So again, just having those sort of moments where you have got the compassion. So just another little thing to break things up. To be happy, you must let go of what's gone, be grateful for what remains and look forward to what comes next. And I know that when we sit there opposite our clients, it's an easy thing to say, but at some point there's got to be an acceptance of what has passed and there's got to be a future focus, which is very much the language that we use in mediation, is to be future focused, which is really important. So the holistic approach to integrating reunification therapy into mediation is learning to manage emotional discussions effectively. And we do learn that as mediators, and that's part of our role. But if we can maybe combine therapy sessions with mediation to create a unified plan, I have found that there are some clients that are still so very heightened in their conflict that their ability to be able to navigate, whether it's a co-parenting plan or a property agreement, the anger is still very much there. They've got to lash out and they've got to fuel it. Perhaps there's a moment where we can pause the mediation and say, maybe go and get some therapy sessions and we can regroup and come back. The case management, which I mentioned earlier, where we work together as mediators and therapists and collaborate to streamline the process, because it is very frustrating. Where does the parent go? Who do they go to? Is that something that we can facilitate? And developing a joint timeline to avoid therapy duplication for families, which we mentioned earlier with court report writers, child impact reports. There's so much duplication out there. And what does it actually resolve for the parents? So some challenges and considerations. Obviously, building trust with reluctant participants. That's a difficult one. I think we all face that on a regular basis. If a parent refuses therapy, claiming bias, gradually engaging them by focusing on the child's best interest, that is challenging. And that's what I mentioned earlier. If a client is not actually hearing the story or the theme of the discussion going along, what they want to do, they can perceive there to be a bias. So in reunification therapy, I have to share that my mediation skills are absolutely critical, because it's really important when you're in that space that you are that neutral person providing that therapeutic support. And it's all about the child's best interest. So really highlighting that fact in that space is really important. And obviously tailoring approaches, as I was sharing with the Muslim family and the Australian family. The communication style with the Muslim gentleman is obviously very different than it is with the Australian lady. So being cognitively aware of that can help in finding solutions and moving things forward, and understanding how extended family dynamics influence decisions. In some cultures and in some families, there are grandparents and aunts and uncles. There are siblings, and there might be siblings from a previous relationship or a marriage as well that we have to consider and take that on board. So when we use the word family dynamics, it's really important as reunification therapists to take all of that on board, because it's not only the parents themselves that can create alienation, for example, but it's also the subsequent family members that can be part of that. So it's bringing everybody together on the same page and understanding that all of their influences will have an impact on how the children feel and how they feel about themselves. And balancing fairness and advocacy in ethical dilemmas, ensuring both parents have equal opportunity to participate and express concerns, because both their concerns are their truth. And it's not for us to be biased or decide who is right and wrong. It is absolutely critical that whatever the parties say and share, that's their truth, outside of obviously extremism, but in the majority of the time, it's their truth. There's a client that I spoke with earlier this morning. She wants to take her children to England because she's got an aunt that's passing away. The husband lives over, or the ex-husband lives in New Zealand. He doesn't want the children to go to England because he feels that the children will miss out on school. But when they go to New Zealand, they'll also miss out on school. Even though he's been saying they'll miss out on school over there, they'll do it in New Zealand. His truth is his truth. He feels that going to the UK means that they're not aligned from a time-wise. So again, we can't take positions in this. We have to allow each of them to feel freely enough to be able to voice their opinion. Because again, when people feel like they're being heard, that's when you can find a shift and a change, and it's being respectful of the individual person's opinions. Life is so much simpler when you stop explaining yourself to people and just do what works for you. And as much as this sounds very simplified, I think that's a really important process for us in the reunification space, to ensure that we keep it as simple as possible, and to remind the family members and the children in particular what is important to them, what works for them. And normally what comes out of those discussions, the children always say, I wish mum and dad wouldn't fight. I wish mum and dad would stay together. And sometimes the simplest thing that works for them is to communicate that to their family members. And a lot of the time the children won't. They're fearful of repercussions. But to be able to simply say, this is not good for me, rather than going on the defensive or getting angry, just saying, this doesn't work for me. I know it's simplifying it, but sometimes we need to remind ourselves, because people do sometimes get stuck into drama. So a couple of a teenager reconciles with his estranged father after therapy sessions, improved communication. There was a teenage boy, he was 18 at the time. These are obviously not the pictures of them. And he felt that his father didn't hear him. He was homosexual, so he was finding it really difficult. His father was a tradie and was very much a boy's boy, even though he loved his son, and he knew his son probably preferred the male gender. The son felt that dad's manner and the way he lived his lifestyle, he probably wouldn't be expected to understand his choices. Both the boy and the father were very challenged with their communication, because they were both on eggshells, fearful of speaking their truth. And as the years went by, they become very estranged. So eventually they came into a therapeutic environment where it was safe for them to be able to speak their truth. The father resigned himself to the fact a long time ago that his son was gay, but he had no issues with it. The issue he had is his son never shared it with him. And as the years went by and his son didn't share, he held resentment towards his son. So you can see how things can actually get out of control when there's no communication. Avoiding common pitfalls, recognizing when therapy is overwhelming and refocusing efforts to avoid burnout. Sometimes it's just too much to work through the therapeutic process, and we have to be honest about that. Are they ready to accept that there has to be some give and take? Are they ready to accept that there might be two versions that will be able to satisfy the outcomes of the parental alienation? Can they do that? Okay. Yeah, basically for me, I think it's really important to focus on that coordinated child-focused approach. I'm feeling that the children are feeling left out at the moment. It's all the parents and everybody else doing all the work, highlighting the need for collaboration between therapists and mediators to reduce stress on families. Sometimes they have no idea what's the best outcome. Reading and training opportunities. I love Parenting from Inside Out by Dan Siegel, for example. Really simple, very straightforward. Sometimes handing out those books to clients might be a good idea. Anyway, thank you. That's my presentation. I hope I didn't go through it too quickly. There's so much content in there, but I hope to have some questions and maybe some feedback from any of you.
Yeah, excellent. Thank you, Dee. Everyone was very quiet, but I think listening and reflecting. One of the points of discussion that you raised was around case management and where do FDRs and fit in. And Elena put in a comment around funding. So maybe we'll start there, Elena, and then see if there's any other questions or comments, and then we can close on that case management.
Yeah, that's what I would like to say, that I have as well. Hello, my name is Jen. I'm a DRP and am a nationally accredited mediator. And this is what I wanted to say, that I am working a lot with Muslim families, and myself as trained in my previous life lawyer and specialized in human rights. I can tell you that Sharia law is saying the child belongs to the father. And father has obligation to provide religious upbringing. And especially when this is boy, the focus is on that. And when the families are separating from different religious and cultural backgrounds, this is a massive issue. Because their community is constantly, you are not really having relationship only with the father, you are having relationship with all his family. Which is feeding the belief that this is the best for the child. And child doesn't have anything to say. The voice of the child, this what you were saying, disappears. Is not heard.
Yeah.
And you know, my PhD was about the child voice as well. That it is a very important part, because we are muted as children and we are carrying this for our adulthood. we are not knowing how to express ourselves, how to speak up. That this has massive consequences for all our career, our education, our relationships. But yeah, it is starting in the moment when we are seeing something is breaking up. And this was as well you said, education. And I think this should be started as well, that mediators and counselors, educators should approach schools and make talks for the parents and citizens meetings, approach the director or the president of PNC, ask them whether you can present such talk, because we need to start somewhere to educate the parents. If we are going to start to coach them before something is going to happen, they are going to come to the mediation if something is going to happen with completely different mindset. Their mindset is going to be reshaped. It's very difficult when people are in conflict, and current research is saying that when people are in conflict, the inner ear is closing up. And they cannot hear. Whatever you are saying is water on the duck.
Literally, physically, we're shutting down that communication. Thank you, Joanna. That's wonderful. And you reinforce the challenges where you've got those really strong cultural, religious, legal conflicts between nations and areas. And I think you also highlighted that, and Dee did, the sibling relationship and how that's impacted. And sometimes it doesn't get spoken about at all. They're treated as a job lot. But of course, parents relate differently to different children. But Elena, I did want to make sure you had a chance to.
Yeah, I just wanted to make 3 quick points. The first one is just wanted to raise that private health insurance. It's a funding stream that I've been using to provide co-parenting counselling, and so I'm accredited through PACFA. So I don't know, certainly I think you may need master's level counselling to be eligible for funding, but that vary. So that's important. The other thing is workforce issues. I guess when I'm the mediator, I'm actually finding it really difficult to find a counsellor who is suitably qualified in co-parenting issues, but also eligible for the funding streams that are so important. And I guess the third point is that only yesterday I met with my supervisor for my regular supervision, and he works at the university, and so I guess we're starting to really unpack the theoretical underpinnings of whether or not it's called reunification therapy, or co-parenting counselling. But I guess it's really important if we want to build a workforce, but also really be evidence-based. We need to come back to, okay, how are we being guided by the work that we're doing? And are we, without being too academic and too fluffy, how are we being guided by the work that we're doing? And building that workforce and building that expertise, and to work collaboratively with the mediators. But I need to know who I can refer to face-to-face, or most people don't like online. Okay.
Yeah.
Yeah.
And that's a really good comment. And it comes down to, as you would know too, I'd imagine, that the therapeutic relationship is probably the very first point where you actually will be able to have an impact on anybody. And who is that one person that the family members are going to be able to align with, that they feel safe with? Is it their general practitioner, for example? Who is that person? But I think it's worth exploring, because there's so much hurt out there and so much pain out there that we need to hopefully try to bring together some skills to be able to make an impact.
Yeah. I think it is quite feasible that after the journey two parents have been through, that they might actually have a really strong connection with their FDRP and their mediator. But then we've got to be committed to scope of practice and roles. Yep. And even though I'm so tempted sometimes to like a continuous review, don't go there, because you need to be able to review. And so that demarc is really important. And so I've been trying to buddy up with other mediators and who are counsellors as well. You refer to me and I refer to you, and we can
absolutely
get some practice going. But I think GPs, to pick up on your point, GPs are really important, because we can sometimes use mental health plans and stuff like that. However, GPs, I'm married to one, they have 15 minutes. They don't really have much time. They're not really genuinely part of this puzzle, apart from being referrals.
Absolutely. Yeah, Joe.
Yeah, when I was actually looking into it, because then I ended up speaking to Joanne for about 20 minutes when I asked if I was allowed to, because I couldn't do a 60-hour certificate unless I was co-mediating and so on. I was looking into all that. But the local GP, from what you've been talking about, health insurance and that type of thing, but from what I know for Medicare, you can get 10 visits with a psychiatrist per year, and they may be able to be used if they're counsellors as mediators as well, to be part of the mediation. So it can work that way as well.
Absolutely, Joe. But I guess what I've been finding is that it's the time frame and the lag to be able to get into, firstly, to see a psychologist, or but also whether or not they often work individuals rather than couples. It's quite a different skill set to working with co-parents. But good point, Joe. I do think mental health plans are great, but it's just particularly in rural, regional communities, we need them to have support now to go through the mediation, not in 6 months' time.
And that sort of leads to, and just to share with people, so we've got psychiatrists, psychologists and counsellors. So counsellors are registered with the ACA, which is the Australian Counselling Association. And counsellors, or PACFA, and counsellors are not part of the Medicare rebate scheme. And that's part of what ACA has been working on. And there's no wait time for counsellors. And even though they're not part of the Medicare scheme, because they're not diagnostic based, the fee difference between the psychologist and the Medicare rebate team is not too dissimilar. So from a cost perspective, which Elena was talking about too, counsellors are readily available, and there's over 19,000 of them in the country. so again, finding out who's got the qualifications, as Elena said as well, and the skill sets to be able to do the work. It's finding who's comfortable in that space. And Elena was saying too, some people only see one-on-one, and not everybody sees groups of people or families.
Yeah, and I've dropped a couple of links in. One is we're trying to build up a panel and get the refinement around being able to find people who are dispute resolution practitioners but have other skills as well, because that challenge of sticking to our lane is really important, because you run the risk of getting caught up in continuing with one client after mediation, and that's going to really get you in trouble and that sort of thing. But then again, the referrals, the connections, all of that is part of the role. So getting really clear about, as everyone said, where the demarcations are. But if you are a member, please update your details. We are going to make a change. So if you don't have a photo, you're not going to be visible, because it looks awful with hundreds of blank people. So if you put your photo in, you're going to be very clear and being able to be filtered. So we're looking at refining that so it can be nice and granular and put in as much detail as you can. Just the other thing I'm also a huge fan of Bill Eddy and the High Conflict Institute, and we've got a collaboration with him for the New Ways for Families course. But for anyone who's not familiar there, and I've also put a link to Unhooked Book Media. There's a lot of his books and a lot of other relevant books for our sector that are there. Yeah. Thoughts, final? We've still got 10 minutes. Any other ideas? This case management issue, demarcation, if anyone else has been working with someone that's taking a role like Dee's, or parenting coordination as well has become, but it is a different model.
Yeah. So there's I think the parenting coordination, I've noticed quite a number of lawyers are taking that on.
Yeah, and they're often doing it as a monthly kind of meeting, but almost getting into an arbitration. Yeah. Elena, you have a comment?
Is there anything a lawyers won't touch?
Probably not.
You've got to get everything to everything.
There's a work going on. Look, the sector is being heavily disrupted, and is going to be, as AI continues, it's going to be, I don't think it'll retain its historic approach through this. It's an interesting time, but I think that one of the things that Dee talked about very much is about that early education of clients, so they know where to go and they can start with getting some goals that are family-centred rather than
arguing with each other.
Yeah, or just seems to me like it's not criminal to separate. Like the law is there as a final safety net rather than the first course of action. And it seems we're flipped around.
Yeah. But and as I touched on earlier, I've got a number of family lawyers that are now erring on that themselves. They've been in the system for a while. They've noticed that it's not working. They're not happy to be adversarial. They want to provide a supporting arm to families in relation to, ensure that your legal rights are established, but not using the law to fight. So I find that really enriching to know that there are family lawyers that are thinking more along the lines of, let's be there and support, but let's not run their separation for them. So they're moving away from that adversarial model. So I'm really happy about that.
Yeah, and there's a number of different models and approaches. And as always in this practice, it's about finding our people, working out who are the ones. Come along to networking sessions and things like that so you can get a feel for who people are. I think Rose dropped the directory. We host a Google map that's got where people are for anyone that's willing to be on there. So go coffees. If you want to host a gathering in your area at a coffee shop or something like that, just reach out, because we've got some of those happen. I try and sort of crystallize them when I'm moving around the country, but anyone else is really welcome to host that as well. And as we've discussed, a lot of us have a number of skills. We're often not straight out of school. we've got a little bit of experience in various.
It's so true, that lived experience. And Dr. Jordan Peterson, who I'm a really big fan of, what he states is that those with native intelligence brings so much value and richness to the table as the mature age person.
Yeah.
And I think it's so true. And when you look at FDRPs, the majority of us are all a mature age. We've had a history and a background, and we bring all that wealth of knowledge to the table, which I think is absolutely critical.
Yeah, no, for sure. Yeah, and again, returning to case management, if we don't know who's around, if we don't know who to refer to, we'll end up sending people to a 1300 number or a website. If they're vulnerable, it's just not going to be fit for purpose.
No.
Yeah. So, any of our quiet people in the background got any questions or comments? No, being quiet. Yeah. So look, thank you, Dee. I suppose the other thing I was thinking about, the whole term of alienation and all of that. I'm not sure if anyone was quivering around that, because I know it can be quite triggering.
Yeah.
Any sort of further thoughts on that? From your point of view, do you name it, or do you just talk about the behaviours?
There's a big discussion as well in scientific world whether there's alienation or doesn't exist.
Yeah. Oh, it's a controversial.
Yeah. This depends of the point of view of the person in particular time and capacity of the person to understand this. That this, really, I think that's important to assess capacity of the parents to use any therapeutic tools. And based on that, we can see which therapeutic tools are correct for them. And I think it will be good if those who are having this more psychological knowledge of assessment will provide as well some workshop for us to learn how to better assess with more deepness what to listen to, because there are I'm greatly trained in behavioral science, that I can see in behavior the person is displaying, what the person is saying, or what is not saying. But not always I'm able to hear in this what is said, and maybe because I am English my second language, what the person is saying when is saying. And because time to time the word that is said is the tool to navigate through or to follow, to understand what is happening with the person. And maybe here to hear the capacity, the voice tonality is as well important. Yeah, we are hearing the hesitation in people's voice or agitation. To learn to listen and to learn to see what we are normal not seeing and not hearing. That I think to sharpen our senses as mediators. Ladies, maybe one of you, both of you.
Yeah, no, it's a good point. I'm actually hosting a group discussion, potential working group on child inclusive practice with younger children, remote delivery, because that's one of the big challenges, is virtually no access for young children. They're in regional areas. So a group of, so anyone that's interested in being part of that discussion, we're having a first meeting on Saturday. And I can just include you in the invitation or the chat group. But yeah, I feel so privileged when I look at who our members are, like the amount of knowledge and intelligence that's there. So it's a great suggestion, Joanna, to look at either inviting someone to present or co-create some tools and resources that we can use. I don't have a therapeutic background, so I tend to look at the alienate. I look at whether the child is displaying alienated behaviour. Are they treating the parent as another, as an enemy, as a polarized, warlike view of them? And I don't have the capacity to work out why. I'm working with what.
Yeah. But it's like the concept of anxiety. So when somebody presents with anxiety, It's anxiety, which is the resulting feeling that a word's been attached to. But what is actually motivating that? Is it fear? There's a whole lot of other things that sit underneath it. So when we talk about alienation, there's a whole lot of stuff that sits underneath that. It might present as alienation, but is there a true understanding of what that word means? And I think that's where, as you say, Joanna, that it can be thrown around. And I've seen it used in court documents, certainly in the last sort of 12 months, where parents are saying, my child's been alienated by the other parent. And they're just using the word alienation, but there's no substance behind it.
No.
There's no therapeutic understanding of what that means. It's just a word at the end of the day, but there's a whole bunch of stuff that can create that end result. And I think that's where we've got to be very careful, because it's not about understanding the word, it's understanding what's behind it.
Yeah, like the example, that you were telling about the father and the son, that this what I was hearing. The father was really jealous that he wasn't the first or one of the first who was hearing about that. He was left behind. Everyone knew, and he was probably the last to whom the information was delivered as well. And of course, that the child was driven by fear, how the father is going to react, because he was a male figure. He wanted to be perceived as worthy. His father opinions about who is the man, who is the woman, yeah. And he was but he still wanted to be loved, because this is our biggest need we have, to be seen, to be heard, to be loved, to belong. Yeah.
Yeah, no, absolutely. Look, wonderful. There's so much more we can discuss, but we'll have to finish up for now. Thank you so much, Dee. That's been fabulous. Now, because we have talked about case study sort of things, this will be an exclusive only member recording. It won't be on YouTube or anything like that.
Thank you so much.
Thank you. Thank you so much for presenting.
Thank you, Dee.
Pleasure. Thanks so much, Joanne.